I'd just like, thank you, just like to thank Professor Genevieve Dingle, who has come to present today on Sharper Minds, a mental health prevention package for university students, which I'm sure will be very apt for us all who work with students within the university setting. So Professor Genevieve Dingle is a registered clinical psychologist and a professor and director of clinical psychology programs at the University of Queensland. Her research focuses on how groups and communities influence our health and well-being. We'll just, sorry, the next slide up. So just want to, firstly, before we pass over to Genevieve, is to the acknowledgement of country. So I acknowledge the traditional custodians of the Macquarie University land, the Watamagal clan of the Darug Nation, whose cultures and customs have nurtured and continue to nurture this land since the Dreamtime. We pay our respects to elders past, present and future. Okay, Genevieve, we'll pass over to you and welcome everybody to the Implementation Science Interest Group.
So this is the bit where I can't find my talk anymore. Oh, no. Sorry, give me a tick. Oh, goodness. All right, sorry about that. I did completely lose it. It's on this screen here. Okay.
Well, when we've got so many screens open, yes.
Okay. Oh, goodness. Okay, I can't find it at all. All right, hopefully I've got the right one there. Can people see that now?
Yes.
Yes. Sorry about that. I must have somehow closed the whole thing down when I was testing the YouTube a minute ago. We got there in the end. Okay, so, and I would also add to your acknowledgement to acknowledge that we're meeting on Aboriginal lands. So I'm on the lands, I'm in Meanjin here in Brisbane. And I'd also like to pay my respects to the custodians and their elders past and present, and extend that to any First Nations people who might be joining us in the meeting today as well. So yes, I would like to talk about the Sharper Minds project, which is a mental health prevention package for university students. And that's my best contact by email on the slide there. So thinking about university student mental health, this was already at a crisis point before the onset of the COVID pandemic. So you may remember some of these headlines, like there was a coronial inquiry into suicide deaths in international students. There was a whole Four Corners report about universities treating international students like cash cows, so oversubscribing and not providing sufficient welfare and support structures. You know, headlines like university student mental health care is at tipping point. So all of this was going on sort of prior to even the pandemic. And then, of course, most of you will know, if you're, you know, involved in teaching in higher education, that the pandemic changed the nature of what our business is, in fact, quite dramatically. So where it used to be, higher education used to be primarily a communal act where people would learn together in classes and communities on campus, all of a sudden overnight, because of you know, the risks of infection and social distancing and lockdowns, everyone was doing this on their own, in their bedrooms, isolated from other students, the nature of teaching really changed because you couldn't build the relationships. You often couldn't even see the faces of the people you were teaching online. And you missed all of the social reward aspects, which is seeing those moments of enlightenment and asking good questions and the engagement that the students have, which is really very much part of the interaction of teaching and learning. So huge impacts in 2020. So I had a look at this because we'd already started this project of tracking mental health and causes of stress and social connectedness in 2019. So actually before the pandemic, we had data there that we could sort of continue to collect to have a look at the impact of the COVID-19 pandemic. So in this paper that was published last year, we focused on loneliness, belonging, and mental health. So I'm calling this the needs analysis phase, which was really just tracking what was going on with first-year university students. So this is 1,239 students, about 30% internationals. The design here is that there were 3 cohorts of first-year students, so separate students in their first years in 2019, 20 and 21. And I also subdivided them into Australian domestic students and international students. Just to have a quick look at some demographics there, the mean age was around sort of 19 to 20-ish years, and the gender breakdown is at the bottom there, so predominantly female in the sample. And these were drawn from across different faculties in the university. So this is quite a busy slide, but I'll talk you through it. So in the top left in panel A, this is looking at loneliness on the UCLA 8-item UCLA loneliness scale, and you can see the domestic students in the bars on the left and the internationals in the bars to the right, and the 3 cohorts are the 3 different grey colours. So you can see in both subgroups that there was a spike in loneliness in the first wave. So from 2019 up to 2020, there was a spike in loneliness, followed by quite a big drop. And in 2021, most people were studying from home, so either offshore with their families overseas or living with their families here, because a lot of the colleges closed down during lockdown and all of that. So actually loneliness went down in that second year of COVID. University belonging is a little bit of a mirror image. So belonging went down, particularly for domestic students, and there was a slight recovery in 2021. Multiple group memberships in panel C, that's a measure that's used in the social identity research to look at sort of social support coming from different groups. Not a huge amount of movement going on there. Down in the bottom in D, this is the number of stresses from a purpose-written survey that we sort of wrote for this study. And here you've got an increase in number of stresses from pre to first wave of COVID, particularly for the international students, and then a slight return in 2021. Psychological distress, this is the PsyCheck, which is a 20-item mental health screener. And it's our main sort of primary outcome from this whole project. So you can see with both subgroups, there was a spike in the first wave and then a bit of a recovery in the 2021. And then wellbeing is the Warwick Edinburgh wellbeing in panel F. And again, it's a bit of a mirror image. So wellbeing went down as psychological distress went up, particularly in that first wave. This is also from that paper. So this is a breakdown of causes of stress. And here we've got data from the domestic and international students collapsed into one sample. And you can just see the 3 cohorts in the different bars there. So some of the things actually got a bit easier or less stressful during COVID. So speaking up in class, presenting in class was slightly lower. And this is probably because people could hide online. They could be on Zoom and just not speak up and not ask questions. So a bit less stress from those. In comparison to things like group assignments, studying for exams got a lot more stressful, because here the students weren't able to check their understanding or check with their friends in tutes or that sort of thing, because a lot of them in first year hadn't made any friends. They were actually just at home. And so they'd either have the courage to email their lecturer directly, or they just didn't know the answers. So those things, preparing for things, was much more stressful. And you can see across in the right-hand side of this figure that things like maintaining a healthy lifestyle, friendship issues, mental health were also quite a lot more stressful during particularly the first wave of COVID there. Now, this graph is not in that published paper, but it is of interest here as well, which is the things that caused stress, particularly around COVID. So this is only data from 2020. And you can see the breakdown of the orange bars being domestic students and internationals being in the sort of yellow bars. These are just to what extent did they agree that these different factors caused them stress. So anything above the 3 was on the agreement side on average. So across all of these different things, being stressed about being actually infected, having travel restrictions, having study and work disrupted and financial hardship, all the way through to running out of supplies. So every single one of them was on the agreement side for international students, and most of them also for the domestic students. Interestingly, though, the coping strategies that were rated as most effective were the same pre-COVID to first wave of COVID, and the top 6 ratings are on the screen here. So listening to music, exercising or gym class, getting good rest and sleep, using stress management strategies, changing location, and simply calling or talking to someone were rated as the highest or most effective coping strategies. This is data that is also quite relevant for this project, which is the percentage of UQ first year students from this subsample of 234 who said that they know about the link between different health habits and mental health, and then who are actually using the habits to support their mental health. So what you can see here when you look across the different health domains, from physical activity, eating well, sleeping well, being socially connected, and using mood regulation strategies, we're getting up around sort of a ceiling effect here, 90 to 100% saying, yes, I understand there's a link between these things and mental health, but much lower proportion are saying they're actively using these strategies to help their own mental health. So much closer to the sort of 50 to 60% mark across the board there. So that gap between knowledge and use is something that we're really trying to target with the Sharper Minds package. So Sharper Minds is a university-wide package designed to increase mental health literacy. So when I talk about mental health literacy, I'm talking about, do students understand that symptoms or even signs of stress is an early warning sign that they could be having a mental health episode, and do they know where to seek help and how to activate that help? And it's also about engagement in those health behaviours that support mental health in undergraduate university students. The full package has been designed by a big team of researchers from different disciplines, but I think the common factors are that it's underpinned by behaviour change principles as well as social identity theory. It is also a bit of a stepped care approach. So the steps are on the bottom of the slide there. So the first step is really to raise students' awareness of mental health, but also mental health supports around campus. Secondly, to get them to start tracking their own signs and symptoms, so with self-monitoring. The third step is to supply a range of short courses that help them to do those strategies to improve the health behaviours in those domains. I won't talk too much in this talk about steps 4 and 5, but just to let you know briefly that in step 4, we actually have postgraduate psychology students embedded in the health service, the GP service at uni, to provide more psychological treatment, so free of charge to students, because at the time the GPs were finding that all of the private practicing psychologists had their waiting lists closed and they weren't taking new referrals. So this was an attempt to try and increase individual access. And then step 5 is referral to specialist services, which is already happening, but this is just to say we're increasing things at the sort of preventative end of the spectrum. So we had a co-design phase in 2020 and into 21, which included 3 focus groups with students, so undergrad and postgrad, domestic and international students from different faculties. We had 3 workshops with GPs, nurses, professionals from the UQ Health Service. We had one with learning systems advisors, so people who are sort of international student advisors and learning support officers at the university. And in those co-design workshops, we started off with the raising awareness piece. So with this one, we wanted to have the website, but also some flyers, posters around campus to raise people's awareness of common signs of mental health issues. So we showed them a couple of examples like these ones and got them to give us some feedback on how they would like the poster and the website to look. And their feedback was that they wanted it to be simple, to have mainly pictures and only a few text or word things. They wanted it to be translated into commonly spoken languages and to show diversity in the students, and also to have a quick link to the Sharper Minds website for more information. So this is the poster that we ended up designing, and it actually has the 8 most commonly reported signs of stress, which is from our own data collection. You can see that the picture is nice and simple, only a few different colours, but it shows quite a diversity in terms of age, gender, ethnic sort of dress, etc., cultural aspects. And then it has a little bit of blurb and then a QR code that takes you to the website. And this poster was then translated into the 8 most commonly spoken languages apart from English. So you can see those there, and just put around student notice boards around the campus. The website looks like this. So it had to be a UQ website for cybersecurity and to get through all of the UQ login systems, etc. But you can see the general layout there and the menu down the left-hand side, which students can click on to go to all the different choices. This is the second page of the website, which has downloadable or printable sort of infographic here about all the different types of support for students at campus. And it's really coded by whether they have any current symptoms, mild, moderate, or they're currently needing individual therapy, or they're currently in crisis. So this was our attempt to try and put everything on one page that would help them navigate the different supports and services. I was going to show you the live website, but I found to my horror on the weekend as I was finalising my slides that the YouTube clips have currently been deactivated, so it doesn't look too impressive right now. But I will play a little bit of one of the clips that you can see on each of these pages, and it will be rectified shortly. So just bear with me while I get that YouTube going. So this is a 5-minute video, but I'll just play you first couple of minutes to get a flavour for what they look like, and they're all a little bit similar in their format.
Definitely like assessment. I find like deadlines, assessment, even sometimes like just starting at uni and getting really worked up about like what is about to happen at uni.
I think there's a lot of pressure on the fact that every grade is going to count towards your future.
There's moving, and then there's paying, and then there's even like just getting late for class. Those small things just kind of sometimes build up.
Trying to achieve the goals, the grades that they want to achieve, and while doing that, maintaining the social relationships they may have, or any personal life hobbies they may be interested in.
Especially with like all these changes coming around, coming into new life, new uni, new course, new friends. And I remember doing really bad on my first assignment, and I just got so stressed out and thought I'd never be able to, you know, succeed and finish.
I tend to stop doing things that I really like doing. Sometimes I stop messaging my friends because I'm so focused on doing something. Other times I just don't go out as much or exercise as much because I'm so focused on trying to eliminate the stress. And just the general, like if I'm really stressed or worried about something, my hands get really cold, my feet get really cold. And it's just like I'm running on adrenaline, even though I'm really not, if that makes any sense.
When I'm getting stressed, I get really hot in the head. I have to take my jumper off if I'm wearing one, even if it's really cold. And I do tend to breathe quicker.
Sometimes my sleep can get pretty bad because I'm lying there and I'm like, I haven't done this yet, or I haven't done that yet. And so that can sometimes ruin my sleep, but I do try to consistently get a good amount of sleep.
I feel like I emotionally eat a lot of like sugar and like just food that you think it's bad for you, but then when you're stressed, you just forget about what's good for you.
I'm kind of the opposite when it comes to that. When I get stressed, I tend to avoid eating. I tend to reduce the activities that I actually would otherwise like to do. My sleep.
Okay. So I think you probably get the idea. And these are all students of mine that volunteered to be in these short videos. And we did it in a little bit like that. You can't ask that sort of format with questions and answers from them, and then sort of edited them down. So sorry, going back to the slides here. Okay. So it's the same format for each of these pages. It has a short video showing students talking to other students about what's in these short courses, or and this one that I've just showed you a bit of is the What is Sharper Minds, sort of the main overview page. Yeah, and then each page has like a little quote from a student, and then a space to click if you're interested to sort of find out more. Then in terms of the second step, the self-monitoring, these were the ideas that we had that we took to the workshops, and we got some feedback from the advisory groups. So they wanted it to be language free. So just to have little icons here for the different domains like study, healthy eating, physical activity, etc. They liked the emoji faces for the ratings, but they didn't want all the different colours. So we decided to just have a single colour for each domain with a shading sort of from bold to lighter. They wanted 7 points for more sensitivity in the rating, and they wanted sort of sad faces rather than angry faces at one end of that scale where things are not going so well in that domain. The students said they would like to be able to do this once a week across semester with personalised feedback, and they also asked for targeted suggestions for courses and supports, and an option for an SMS therapist support, which we didn't have the resourcing to do just yet, but these are other ideas for further development. So this is what we ended up with in the tracker. So this is just one domain. For example, the social connection, you can see we've got the emoji face rating. So they literally just have to tap one face. That is, so for each week it is, over the past week, how have you been going in this domain in your social connections? And they just rate that, and they rate the other domains, and then they'll get a personalised graph looking a bit like this across the semester. So the idea there is just a little bit of time where they're getting some feedback to say, oh, I'm sort of traveling along okay, or I'm actually improving on this domain, or I'm getting worse on this domain. We hope that that would be a source of motivation to sort of engage in more of those healthy behaviour strategies. And backing those up are the short courses. So these offer students a choice of health behaviours to focus on from those 6 domains. They're all evidence-based and developed by colleagues, myself and my colleagues at UQ, who are specialists in those different areas. They're delivered in real time over Zoom in small groups, so usually about 6 to 8 students in a group with 2 trained and supervised facilitators who are postgrad students. And the reason we kept them in real time was because it actually increases student engagement and gives them a chance to ask questions and make a meaningful contribution, and even maybe make some friends within their group across the 4 sessions of the short course. So you can see a range of the different ones there on the screen, including down in the bottom left, there's the dietetics one, and they actually end up getting ingredients and cooking and eating a meal together. Even though it's over Zoom, it actually worked quite well. So these are the 6 domains I've been referring to, and this is the names of the short courses that target each of the domains. So in study, it's My Tuned In course, which is a music listening for regulation of emotions related to sort of academic scenarios. So that might be panic or stress or disappointment, as well as focus and study, as well as related things like procrastination, perfectionism, etc. The second one is Groups for Education, which is around building your social connections and supporting your identity as a university student. The physical activity one is called Fit for Study, and it's around decreasing sedentary behaviour time and increasing physical activity in amongst your sort of busy life as a student. The mood course is called Grunt, and it's a short version of a resilience, CBT, mindfulness kind of course. The healthy eating course that is run by colleagues in the dietetics and nutrition sciences is called Food for the Brain. So it's around shopping and cooking food that is going to be good for cognitive health, as well as minimising food waste, and all of this on a student budget. And then the sleep one is called Better Sleep, and it's basically a CBT for insomnia short course. So we're now in the implementation phase. The goals here are to make Sharper Minds package freely available to all UQ undergraduate students who want it. Obviously, it's not going to have capacity for all UQ undergraduate students, but it's an opt-in course, so we want everyone to at least know about it. So to do widespread promotion through on-campus orientation and student welfare events, as well as through the IT systems and the social media accounts to students. We also aim to train and supervise about 25 to 30 facilitators, so postgraduate students, annually to deliver the short courses. And in that way, there's no direct costs because the facilitators are earning supervised practice hours towards their professional qualifications. We also obviously want to evaluate undergraduate student engagement, retention, and the effectiveness of the package. And we're working towards handing over, so transitioning from it being a research-oriented project to business as usual project through UQ Student Services. So this is just a little bit of interim data. We're still in the implementation phase, but I did have to run some analyses to report to the funders at the end of last year. So I'm just going to report those to you here. So this was 264 students recruited from across different faculties at the university. You can see some of the data on the left there. So average age was 20 and a half. Again, predominantly females. About less than a quarter were international students, and a third had a history of a mental health diagnosis. Just to say also that I've registered this 3-condition trial on the ANZ Clinical Trials Registration, and the target number of people is 390. So we may get there this year, we're hopeful, but I'll just tell you where we're up to at the moment. So this is a non-randomised control trial with 3 conditions. The non-randomised is because choice is really important. So we want students to opt in rather than to sort of randomly assign them to anything. And so the control condition is students who just did the beginning and end of semester survey and nothing else. The one intervention are people who did the surveys plus used the weekly tracker at least 6 times, or did the pre and post surveys and 1 short course. So the average delay between, or period of time between survey 1 and survey 2 is at least 6 weeks. So we're sort of thinking of that as being our dose, if you like, and then compared to 2 interventions, meaning they're using the weekly tracker and they've completed 1 short course. So I'm just selecting some findings for today. So this one is our key outcome, which is psychological distress symptoms on the PsyCheck. So this is scores out of 20, and the cutoff for a positive screen on this is above 5. So you can see that the means are all on the positive side of mental health. And you can see here that the control group actually got a bit worse over time, whereas the people in the 2 intervention condition on the right got improved or decreased in their psychological distress over time, and no change in the middle there. So that was a significant interaction. In terms of confidence to seek mental health information, we've got students in the control condition actually reducing their confidence, whereas the students in the 1 intervention condition increased a little and already were higher in the 2 intervention group. Loneliness significantly reduced over time for students in the 2 intervention condition, but no significant change was found in the other 2 conditions. Academic motivation significantly reduced in the control condition, while it remains stable in both of the intervention conditions. And overall, we had a 70% retention across semester, and this was 2 semesters last year when we had launched the full package. And I thought I'd just give you a few quotes from the post surveys of students who had participated in different aspects of the package. So this one was a student who used the weekly progress tracker. It was beneficial for me to be able to track what was happening with my sleep, eating, study, etc. habits, and to be able to sort of deduce what was happening in my life that was influencing my daily habits. A tuned-in participant said it was very interesting to see how other people use music to study and focus. I've always preferred quieter background music without headphones, but it's given me some good suggestions of music, different music to try and work out what could work. Also, the facilitators were fabulous. They were both engaging and dedicated. A Groups for Education, so the social connections group participant, I really enjoyed discussing research findings on social connection and its importance for our health, as well as practical strategies for strengthening and broadening social connections. A Fit for Study participant said, I liked how we were able to share what works and doesn't work for us in terms of exercise in a small group and hear what others struggle with and find helpful as well. It was beneficial to go through the different aspects of exercise, such as stretching, types of exercise, intensity, duration, etc., as I didn't know some of this. Food for the Brain participant said it gave me ideas and information about healthy eating that I could implement and use. It was simple to understand and I loved the practical components. A Grunt participant said I liked how kind and easy to talk to the facilitators were. I also like how it gave me a different perspective and deeper understanding of what mindfulness is. And finally, a Better Sleep participant said the Better Sleep package was really informative and helpful in providing useful tips and tricks to improve sleep quality. It was engaging through the use of group activities, and the sleep diary portion was super enlightening. So just thinking about what the facilitators of successful implementation have been. So I think being able to embed it into existing orientation and peer mentoring programs for students has been very helpful, and that has been more successful in my own faculty. So the Health and Behavioural Sciences faculty has had really big buy-in, and we've been able to sort of talk to students through a range of different existing schemes. It's been slower and more difficult to navigate into other faculties who are doing their own different kinds of peer mentoring and orientation work. By far our biggest driver is course credits. So when we can get first year psychology students who are able to get SONAR research participation credits as part of their first year courses, that's been really super helpful. And those are not necessarily psychology, psych science students. They can do electives from all different faculties. So that gives us a reasonable spread of first year students. I've done a fair bit of in-person promotion, just 5 minutes at the start of large first year lectures. So definitely to the big psychology courses, but also to Health 1000, which goes out to all of the medical and allied health students. So where they actually see me talk them through what the options are on the website, we get a big spike of recruitment from that. So sort of needing ways of cutting through all of them, all of the emails and messages that are coming to students all the time. It gets very busy and a lot of them aren't reading them properly. And so it's best if you can go in person. Also, I think once people do sign up for something, the quality and the relevance of the short courses and their relationships with the group facilitators have been, really positive and very engaging. And also the responsiveness of the admin team. So when a student expresses interest through the website, one of our admin team get back to them really quickly and talk to them about, availability and times and options and things. And I think that responsiveness is really important too. But it hasn't all been smooth sailing by any stretch of the imagination. So there's been lots of barriers as well. So the first one I would say is that timing is everything. So we ideally, as a preventative package, want everything to happen in the first half of semester before students get really bogged down into assessment and get sort of very busy with work and other sorts of commitments. So the problem there is that we have to have availability of the group facilitators who are new students themselves. So we're training up mostly master's students in the Masters of Psychology, Masters of Clinical Psychology, and dietetics and exercise phys. So at the beginning of semester, they have to have all of their own intensive training to sort of start their own courses before we get access to them for this sort of research project. So it's been very tight sort of turnaround at the beginning of the academic year. Promotion is hard because it's a huge amount of work and it's relying on one part-time postdoc, 2 casual RAs and me, and I'm in a director role with very little research time. So it's been just really hard to get enough access to students across campus. Even when students know about it and have signed up on the website, they often don't respond to emails. So we get back to them with, here are your options. Would you like to do this or that? We often don't hear from them again at that point because they're not reading their emails. So that's often a barrier. Just down on the bottom here, the cap on SONA credits. Sort of after we launched this implementation, the Psychology Research Committee that runs the SONA credits decided to cut down the maximum number of SONA credits you could earn from any one study to 3. So we suddenly had to turn around and cut down all the short courses to fit within 3 hours of student contact, which was not fun. Student services staff who are quite interested and have come along to some of the training, facilitator training, but at the moment they're flat tack, like they are not given any workload alleviation from their usual duties to come and be facilitator trained and then to deliver the short courses. So at the moment it's a penalty to them if they're involved, and we need to find some ways of alleviating that workload. And we haven't been successful yet in embedding Sharper Minds or even the annual surveys into university-wide IT systems. Ideally, what we're talking to people in those systems about is putting a My Wellbeing or some kind of link on the landing page when people first log in to their email, so that it's there and they can do a self-assessment, get some feedback, and then be directed into any of these packages, not just from Sharper Minds, but across all of student services, the psychology clinic, the medical centre, etc., just to sort of help them navigate from a single landing point. That's aspirational. There's a lot of reasons why it's difficult to do anything through the central IT system. So that's a work in progress at the moment. So just some interim conclusions. The Sharper Minds package is co-designed, it's free for students, and it's effective for those who engage in both the weekly progress tracker and the short course. Promotion and recruitment needs university level support. We're doing a lot at the grassroots level, but we really need a more coordinated way of getting out to all students. The model of delivery, that is training postgraduates to deliver to undergraduates in return for supervised practice hours, is effective, and it's currently offering a choice of online or in-person groups. This year we were able to move back to some in-person groups as well. We're currently working on increasing the equity, diversity and inclusion components, both from the look of the website, the videos, the information, but also potentially increasing the course offerings for things that are about intersectionality and finding your place and finding your tribe at university, that sort of thing. We're also doing a lot of outreach this year to the students who are in the residential colleges and also at Gatton campus, which is about 3/4 of an hour drive west of Brisbane. So just some quick acknowledgements. It's a huge team effort. I've had part-time clinical research psychologists over the last 3 years, so Radhika, Elise and Julie. I've also got casual research assistants. Some of them are in the photo here. And then my colleagues from the different disciplines. So they're all listed there and wouldn't be possible without everybody contributing. And also huge thanks to funding support from UQ Vice-Chancellor's Office, the DVC Academic, Allianz Care, who's our preferred provider for international students' health cover, and UQ Healthcare. And that's it. Thank you.
Thank you very much. That was very, very interesting. Can we get a full screen? Sorry, I just need to see who's all there. Thank you very much. That was really, a great program that you've developed. That's having a daughter in university who's working in those residential colleges as well. Yes, it's great to hear that you're trying to reach those colleges, because there's a lot of issues seems to be arising in that space. Is there anybody online that have any questions? Would you like to unmute yourself or put your hand up? Let's see if there's any questions in the chat. Oh, Andrea. Yeah, Andrea, thank you.
Thanks, Genevieve. That was really interesting. I'm interested to know about the student services and getting it involved as business as usual. Obviously, you identified that as being a key challenge in terms of sustainability. And I'm just wondering if you had any involvement, got them involved at the beginning when you were designing it, similarly with the other faculties.
Yeah, so probably could have done more. So we did have a sort of a series of meetings with different people from student services, and we were sort of all sitting on a higher level mental health working party at the university. I think one of the issues there, which is ongoing, is just shortage of time on everybody's part, to sort of get people around a table together. I think they've been increasingly interested in and cross-promoting Sharper Minds in their discussions with students. I think they're quite keen to be involved, but the problem is that something's got to give. They've got to actually find someone to do their day-to-day work if they get invested in what we're asking them to do. So we haven't really gotten around that issue yet. The idea that theoretically we're turning off the tap. If we do a lot more work at the preventive end, we should have a bit less pressure on services one-to-one, sort of at the pointier end. But yeah, it's sort of something's got to go first, and it feels like it's more of a penalty, I think, to them time-wise at the moment. Yeah, and the other part is trying to integrate what we're doing with what they're also doing. So they do also have some group courses. They do also have some preventive things. So for them, I think it was a bit difficult to sort of figure out how to slot the Sharper Minds package into what they were doing. But they can see the point of it being very UQ bespoke, really about our students and what they say they need. Whereas they had a number of courses that were self-paced sort of recordings that people would do in their own time, that were perhaps delivered or developed elsewhere, so not as bespoke to UQ students' experience. And what happens there is that people might be interested and start them, but often don't complete them because there's no motivator. There's no one that's kind of helping them through that material. So that's one of the reasons we have kept it live in real time, where people can engage and ask questions and make some friends and that sort of thing, because I think those components are really important. So yeah, I think that we can do more, and we will be doing more to sort of work alongside student services. Also should mention that Radhika, the current sort of project manager, is embedded. So she's up there 1 day a week. So she's talking to them, going to their team meeting and keeping it on the agenda, I suppose, as much as possible as well. So, but yeah, we've got more work to do in terms of the business as usual kind of phase.
And just a follow-up question. You mentioned that one of the issues was with the students who had, I think, expressed an interest and then they weren't responding to emails. And I noticed in one of your earlier slides, you said that they were interested in, I think, follow-up by SMS. Did you have any, or is that something that you could think about in the future, was doing SMS rather than email?
Yeah, so the reason we haven't yet gone down the track of having SMS support is that we just don't have the resourcing. You know, like if you give them that option, you need to be available, because if there's someone's in crisis on SMS, you need to be able to respond, and we just haven't got the cover. So we haven't opened that option yet. And really, for the workforce that we're using, which is postgraduate students, they are only available part of the year when they're under their supervised practice plan. So we don't want to promise something that we can't really deliver, I suppose. What we're looking at, though, at the moment is doing more with the weekly tracker. So this year we added an extra item. So we have the 6 domain ratings, and then we have an extra item which says how many pieces of assessment have you got due this week, which is just to try and give us a sense of, because students are coming in from all different schools and faculties. So they'll have different peaks and troughs of assessment load and stress during the semester. So we're wanting to sort of at least account for that in our analysis. We could add, say, another thing there, which hopefully can give, you know, so there may be a way we can do an algorithm saying if they've gotten worse on a domain over 3 consecutive weeks, it automatically sends them some message. Anything that you do like that is really complicates the IT programming. So we're just sort of waiting to see what the data says for this year before we go ahead with decisions about that. But there is capacity to do more with the weekly tracker.
Well, that sounds interesting. I was also just wanting to ask. So I noticed that males are not engaging as much. And also you mentioned diversity. So I just wondered how you're catering to those, you know, that with the diverse needs, and also maybe, you know, English being a second language. Just wondered how you were doing that.
Yeah, well, so I guess from the resources point of view, we've got the translated posters, and we've got students from diverse cultural backgrounds shown in the video. So we're trying to make that sort of something where students from all backgrounds can see themselves represented, at least. In terms of the content of the courses, though, that hasn't necessarily been, you know, reviewed from an EDI perspective. And so that's more work that we need to do. I mean, the team itself is quite ethnically diverse. So all the people that are contacting them in terms of responding to messages, and quite a few of the course facilitators are also from non-English speaking or international student backgrounds. So I think those things are sort of just almost happy accidents, but they do help when we get that diversity. But yeah, I'm sure there's more we can do in terms of all sorts of different access points. You know, we want to talk to, so we've been collecting data this year on whether students are neurodivergent, whether they have mental health issues, physical disabilities, etc. So we're collecting that, and we will be analysing what are they engaging with if they're in these different subgroups, and what are their needs, what is their mental health literacy, are they different from, you know, neurotypical all of that. So we'll be able to analyse that in greater depth at the end of this year, and hopefully sort of develop things further according to those needs.
Yeah. Is there anybody else got a question? Seamus, did you? Yeah.
Hi, Genevieve. Thanks very much for that presentation. I've just been reading recently some interesting work on implementation science and complexity theory and complex systems approaches to implementation science. So I apologise for trying to foist upon you something that I've just had an interest in recently, which may be not at all what you're interested in and what you're sort of trying to focus on in your work. So apologies in advance for that. But I was just interested in the way that sometimes implementation science can encourage us to try and consider a larger system within which an intervention is taking place, including elements that aren't necessarily immediately visible, and to be conscious of unanticipated, unintended effects. And yeah, just I thought it was interesting. Yeah, going back to the previous point raised about the very low levels of engagement from male students, and I just wondered, as well as the great congratulations on the great success of this intervention, but I just wondered, is it worth taking into account those that still fit within the sort of student mental health, prevention system, so to speak, but who are not necessarily being reached? And as fantastic as the results you've had are, is it possible that for the students and the types of students who didn't want to engage with this sort of, is it something worth thinking about in terms of how we might try and reach them, and whether when one initiative is really successful, in a sense, if it doesn't suit a certain group, it could have that unintended downstream effect of making them potentially alienated from services and feeling that it's not kind of catering to them. Sorry if that's an unfair question, but it's just based on what I've been reading in the last couple of weeks.
You're absolutely on the nail there, because and I should have probably prefaced the whole talk by saying, as I told Yvonne when she invited me, that I don't know anything about implementation science. So I'm sure people out there are going, why are you doing it like that? So I'm all ears about what the implementation science would say here. But you're absolutely right. We don't know anything about the people who are not, getting on the website and engaging with something. And it could be because they don't feel it's for them, or that they don't feel they need it, but we won't know if we can't reach them. And I don't know what the answer is to that. We try to make it as widely known, at least, and easy as possible. And we're trying to build in incentives for involvement, and we're trying to normalise all of it as all of university students. It's not just people who feel like they have a mental health issue, but there's still large numbers of students who we're not reaching. So yeah, if anyone on here has wisdom about how you would do that. I mean, obviously, if we had a university-wide annual survey, that would be ideal, and getting them before they even start would be great. So that's something that I'm sort of pushing for. But I think the general consensus is there's so much information getting out to students early in semester with all their enrolment stuff, and they get confused as it is. So it's quite tough to break through that thing, and with a research kind of project, they're a bit conservative about what they send out en masse. So it's still an ongoing conversation.
Let's ask really just a small practical question. We've just been doing some work on stroke secondary prevention and apps. And some of the feedback we've got from GPs and concerned kind of health professional stakeholders is that when you give people an app that potentially is monitoring something, whether it be blood pressure or mental health, there was some concern from health professionals that some clinician needed to have responsibility for that they couldn't just be sort of sent off. Someone had to be almost, medico-legally responsible in a sense, almost, for monitoring. I was just wondering if that is an issue, or if that's come up, or if is of concern, or you found a way around that?
We haven't found a way around it, and I suppose, I think so everyone who joins the project has to have a login, so they log in through their UQ login authenticate system, and then they have to see the consent sort of process, and then they do the pre-survey. So it's clear in the consent process that this is not treatment or therapy. This is not aimed at people who have an ongoing mental health problem. This is prevention, blah, blah. So it goes through all of that. And you know, we don't have the resources to be continually monitoring the data as it comes in or responding in real time. So I think it's the same as any sort of research project where you're asking about mental health and well-being, you know, that there's always that risk that someone is going to be saying something that you don't really know about until you've downloaded your data down the track. So yeah, I guess there's a small thing, but we try and get around it with the website saying if you're in crisis, this is where you go, that kind of thing, and trying to sort of summarize all the different options, and that we're at the very first bit here. We're not all of those things. Yeah, it's
a tough one, isn't it? Thank
you.
Thank you. Is there any other questions at all? I just wanted to quickly ask one. One more was, do you see this sort of model, you know, being scaled up to other universities? Have you had other people interested?
Yeah, well, I have. We haven't sort of done a huge amount of presentations, although the team is coming down to the CBT conference in Sydney this year. We've got like a whole symposium around university student mental health. And we've seen other university researchers present over recent years on other sorts of approaches. I know I was talking to Louise Sharp, who's the Dean of the Graduate School at University of Sydney, and she was interested in whether they could have a sort of a higher degree, like a PhD student sort of version. So there is a bit of interest, and I think it is a model that could be replicated for the context of different universities and their different sort of student bodies. You could definitely, if you had postgraduate students training in health, I mean, I think that's the workforce that you need to be looking for if you don't want huge direct costs of delivery. So that would be a model that could be replicated in other universities where they have, you know, postgraduate psychology, dietetics, exercise phys, etc., to sort of think about what their resources are that they could direct towards the undergraduate student needs. Yeah.
Yeah. Okay. Oh, well, that would be great to see that sort of happen, and that would be a really good win if you could sort of scale that up across the country. I'm just very aware of the time, but so I just if there's no more questions, I'd just like to thank you very much, Genevieve, for joining and presenting to us today. It's been really valuable, and I think your implementation knowledge, I think, was well represented there. I think you
fake it till I make it, you think?
Yes, I think some very great information there, and lots for us to think about. But so thank you from us all. Thank you.
Thanks for having me, and great questions from your audience too.
Thank you. Bye.